Hi, Paul Sakis, Good News Planet. And we're going to talk today about a prevalent condition that can lead to serious outcomes, may often go undiagnosed and undertreated. Peripheral artery disease. We have Dr. Geoffrey Barnes, cardiologist, vascular medicine specialist, and faculty member at the University of Michigan, Frankel Cardiovascular Center and Institute for Health Care. Good morning, doctor. How are you?
I'm doing great. Thanks for having me today, Paul.
Well, thank you for speaking about concerning health condition. Peripheral artery disease, or PAD. What is that?
It's a great question. PAD is a chronic condition that affects the blood vessels primarily that go down to your leg. So what happens is these blood vessels start to get narrowed, and when they narrow, it limits the blood flow down to the muscles of the leg and the feet. And that can lead to a whole bunch of different problems. It's a really common condition. We actually think it impacts somewhere around 20 million Americans. But unfortunately, less than half of them know that they have this condition. So it's largely under-recognized and underdiagnosed. That's particularly true for certain groups of Americans. We know, for instance, that Black Americans have a much higher risk of PAD. And when they're diagnosed, it tends to be later, which means they tend to have more serious complications than white Americans.
Oh, my God. Okay. So what are some of the early on symptoms that would make you want to consider, going to a doctor and, saying, hey, this is happening to me?
Yeah, that's an important question to ask. So the classic story for somebody with PAD is they'll develop some pain or discomfort in their legs when they walk, but that it gets better when they rest. However, many people tell me about numbness or tingling. Sometimes they use that term pins and needles in their feet or their lower legs. I even see people who have sores and wounds on their feet that just don't heal up. But I'll tell you, Paul, one of the most common things I hear from folks is they come in, they say, I just can't keep up with my grandkids anymore. The kids want to run around, but my legs just give out and I don't feel like I have the energy. And that's often a sign that there could be PAD, especially if it's somebody who has important risk factors like smoking, diabetes, high blood pressure. If I see sort of this story and those risk factors put together, boy, I'm really thinking that PAD could be a potential cause of that problem.
What is neuropathy?
Neuropathy occurs when the nerves that go down to the feet just don't seem to work pretty well anymore. And so often people with neuropathy will lose feeling, or they might get the numbness and tingling. Often folks who have diabetes can develop neuropathy, but folks with diabetes can also develop PAD, or peripheral artery disease. Diabetes can affect both the nerves and the blood vessels. So it's really important that you get checked out by your doctor, figure out if either of those may be the case so that you can start getting some of the treatments going. Otherwise, people are at risk for having some complications.
All right, so they thought I had a neuropathy. They checked me for neuropathy, but I still have a little bit of a tingling on my foot going down my leg. But my question is now that you're bringing this up, and no one has actually mentioned this, PAD to me, and this is new, how do I look into this? Because I'm wondering. I'm through orthotics. I'm through a lot of stuff. I got a tendon that went down. And so how do I proceed? If I
PAD is really, so PAD is really common, but it's often helpful for patients to ask their doctors about it. So one of the things I always recommend, when you go in to see maybe your primary care or family doc, or if you're going in to see a diabetes doc or a heart doctor, somebody like that, encourage them to let you take off your socks and shoes. That way they can look at your feet and they can feel for the pulses in your ankle. If they notice anything about the skin of the feet, or if they can't feel the pulses, something there's not right, that's an important time for them to start doing some of the diagnostics. It's also a great opportunity for you to start having a conversation with your doctor about whatever kind of leg complaints you might have, whether it's that numbness and tingling, or whether it's not being able to keep up with the kids. taking off the socks and shoes is a great way to start that whole process.
So also, let's thank Janssen for bringing this to everyone's attention. So how does, if somebody is diagnosed, so they do see that there is this problem, what's the next step?
Yeah, so if you're diagnosed with PAD, there are a number of different treatments that we can offer. Sometimes they involve taking medicines that help to protect the blood vessels, not just of the legs, but the blood vessels in your whole body. We know that an important complication of PAD is that it puts people at risk for heart attacks and strokes, in addition to a risk of amputation, losing part of your foot or your leg. So the first thing we do is get people on some important medicines. But we also want to make sure that they quit smoking if they're a smoker. And we try and get them into an important walking routine, so that we really try and build up the ability for their leg muscles to function as well as possible. There's a number of other more advanced treatments that we can use, but stopping smoking, getting on the right medicines, and getting people walking safely are three of the most important things we can do right off the bat.
Why is smoking so concerning? You clog up your arteries? What happens?
Yeah, you're exactly right. Smoking has a number of bad effects on blood vessels. It causes them to get clogged up. It causes them to get stiffened. It causes them to be more likely to develop clots. But it's especially bad for people with PAD. In fact, smokers are at 4 times higher risk of developing PAD than non-smokers. And people who keep smoking, half of them will develop a heart attack or stroke within 5 years. So it's a major risk factor, and I really work hard with my patients to help them try to quit smoking. It's such an important thing they can do to improve their own health.
Okay, Dr. Barnes, thanks so much for sharing. Is there a website or somewhere we can go to learn more, or at least tell our doctors and to consider this?
Yeah, there is. I often encourage patients to go to this great website. It's vascularcures.org/PAD. There's awesome information there about what PAD is, what you need to know about the diagnosis and treatment, and it'll really help you prepare for that conversation the next time you see your doctor. So I encourage you to check out vascularcures.org/PAD.
Okay, thank you very much, Dr. Barnes. Good information and important information by far. Thank you.
Thanks for having me.
Bye-bye.